Hello, and welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens, and I'm bringing you another in our series on the Voices of Innovation AI edition book. I've got another one of our wonderful authors with me. You may recognize Kumar from a previous appearance on the podcast, but Kumar, for those who didn't get a chance to hear our previous conversation, will you please introduce yourself?
Thank you, Jennifer, for inviting me on your podcast again. It's lovely to be here. My name is Kumar Subramaniam, and I am the CEO President of Safe Tower. Safe Tower is a spin out from Johns Hopkins. We developed safety management solutions using artificial intelligence and other tools with the goal of helping safety leaders everywhere understand what's happening to their patients in their care while they're in the hospital. And thanks again for having me here, Jennifer.
I'm always glad to have you back. And as you know, one of my very favorite areas of interest is the intersection of technology with the medical culture who ends up using it. And I want to talk a lot more about that. But first, I want to back up a little bit and ask you, how did you get connected with the Voices of Innovation community?
We have a joint, so we have a common connection. Jennifer, his name is Alan Moore, as you know, and he connected me with you, and he is the great connector, if you will. He also connected me to the Voices of Innovation editors, and that's how we got connected with that piece of work.
He's such a delight. I love Alan. So tell me a bit about safety and culture in the medical environment, and talk to me about Safe Tower in particular.
Well, there is always in healthcare this tendency to watch out for medical legal claims and or claims by third parties against the hospital system. And so there is unfortunately an incentive to not report for fear of being financially harmed. And that has led to all kinds of perverse practices. And as we all know, the incidence of voluntary reporting in hospitals is very, very low. And so there have been a lot of attempts to remedy that, but none of them seem to be really taking hold. And at SafeTower, we decided to do something about it. And that essentially boils down to making people heard, making them feel that their voices matter, and how can we use innovation and machine learning and artificial intelligence to enable people's voices to be heard in their full context, as opposed to partially, dealing with the inputs that we force them to enter on our behalf.
So it's interesting because I think in healthcare we often think about artificial intelligence as a way to lift like documentation burdens, and we think of artificial intelligence as having some interesting implications for predicting which patients are going to be sick. Tell me more about AI and machine learning to keep patients more safe.
Um, what we're trying to do with artificial intelligence and with machine learning techniques and others is to understand what happened. So it's by definition a look back into understanding what happened to a particular patient at a particular time in a particular department, and then to be able to extrapolate from the information what can be done about the surrounding factors that led to that safety event so that they don't occur again. So that's where we're using machine learning to kind of help safety experts do their jobs better, right?
You did some really interesting development too with some natural language submission of safety incident data. Did you collaborate with like floor nurses, or where did you seek input when you were thinking about how your end users are going to interact with this technology?
So this invention was created at Johns Hopkins, and the lead inventor is an oncology nurse who became a product developer and by accident. And she got so fed up with having to deal with the systems that they had currently in place at Johns Hopkins that she decided to do something about it. She teamed up with a colleague of mine. Her name is Eileen Kazda. And Eileen was the safety operations expert at Johns Hopkins. And together they decided to build this new solution where they decided to throw out all of the preconceived notions that the industry had about safety events and decided to use the nurses' voices in their entirety, as opposed to stripping out information and making them jump through hoops to report incidents. And instead of doing that, all they said was, tell us what happened in your own words, biases and emotions and feelings and everything, and we'll take care of the rest. So that's how we started off on our journey of creating an algorithm using machine learning as well as natural language processing to parse through nurse-provided information, narratives, and from there figure out what themes were at play that various department leads and others needed to be informed about so that they could then come together collaboratively and talk about what had happened and then decide collectively how they could make a difference for that particular patient and other patients of similar situations in the future.
Yeah, I think it's fantastic. I think two things that really stick out to me. One is the user-centered design that is sort of overlaying your technical achievements as well with your machine learning and your natural language processing. And the other is the collaboration that has really led to some really interesting innovation for Safe Tower. Is there anything else you want to tell me about your chapter in the book that I have not asked you?
I think the main things that we think are important to keep in mind is healthcare has mountains of data, but very little information that is useful for safety leaders and or healthcare leaders to use. And so our attempt at using artificial intelligence for the safety use case is a precursor to kind of exploring this idea that machine learning and artificial intelligence can actually produce good quality information. And with good quality information, you can make better decisions with lesser amounts of data. So more data doesn't mean better decision making. In fact, it could quite mean quite the opposite, actually. So that's what we're trying to do here. We're starting off with safety. That is our flagship solution today. We're now also wrapping up our patient grievances and complaints solution using the exact same technology, the exact same user interface design. And then we're finally developing our actions and analysis solution, which essentially uses artificial intelligence and machine learning to help safety leaders and quality leaders do investigations on safety events using a variety of techniques and in the process also unburdening them as they go about figuring out, okay, what actions do we need to take to ensure that this safety event doesn't happen again or this grievance can be minimized in the future? And then how do we make sure that whatever we are putting together is actually feasible? So you can see the pattern here, right? We are going from, people talking about safety reporting and grievance and complaints reporting to actually helping leaders do something about it.
Yeah, it's phenomenal. I love it so much. It is always a joy to talk with you, Kumar. I'm so glad that you were able to find time to come on the podcast. Always delighted to speak with you. Delighted to appear with you on the author list of the Voices of Innovation AI edition, which will soon be for sale. The sales go to support cancer research. Many thanks to our editorial committee who put this fantastic book together, and really appreciate you and your time. Thank you so much for coming on today.
Thank you, Jennifer. I appreciate you a lot.
Always a delight. Thanks.